Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear respected ICTV community members, today I will address the effects of social distancing due to COVID-19 on seniors. Again, I would like to state my talks will be based on my scope of practice. As I mentioned before, I'm an associate clinical social worker and a behavioral health therapist. I'm not a religious scholar and will only address mental health topics. Of course, my audience is Muslim, and anything I will say will keep in accordance to the Muslim traditions. In the Quran, according to Surah Al-Isra, ayat 23 and 24, Allah subhanahu wa ta'ala says, "Your Lord has commanded that you worship none but Him, and that you be kind to your parents. If one or both of them reach old age with you, do not say to them a word of disrespect or scold them, but say a generous word to them and act humbly to them in mercy, and say, 'My Lord, have mercy on them since they cared for me when I was small.'" In a hadith according to Al-Tirmidhi, Prophet Muhammad sallallahu alaihi wasallam said, "He is not of us who does not have mercy on young children nor honor the elderly." A new report from the National Academies of Sciences, Engineering, and Medicine points out that social isolation in this population is a major public health concern that contributes to heart disease, depression, and premature death. For seniors who are homebound, have no family, or do not belong to community or faith groups, a medical appointment or home health visit may be one of the few social interactions they have. Dr. Alicia Arbahe is an expert in general internal medicine and geriatric medicine. She's the Director of Transitional Care Research and Associate Professor of Medicine at Johns Hopkins Medical Center in Baltimore. According to Dr. Arbahe, when it comes to COVID-19, the disease caused by the new coronavirus, older people are especially vulnerable to severe illnesses. Research is showing that adults 60 and older, especially those with pre-existing medical conditions, especially heart disease, lung disease, diabetes, or cancer, are more likely to have severe, even deadly coronavirus infection than other age groups. If you're caring for an older loved one, you might be worried. Here is some important information she has shared about what you need to do to keep elderly people safer and what to do if they do become infected with COVID-19. Keep yourself well. First and most important, as a caregiver, you should take all the precautions you can to avoid becoming infected yourself. Here are the basics. Wash your hands frequently with soap and water for at least 20 seconds before and after providing care, preparing food, using the bathroom, or touching surfaces in public places. Avoid crowds, and if you cough or sneeze, do so into the bend of your elbow or into a disposable tissue. Keep your hands away from your face. Clean frequently, touch surfaces in your home often, including mobility and medical equipment used by your loved ones, such as walkers, canes, and handrails. I will add that the caregiver needs to allocate time to relax for themselves, at least an hour at a time. Use the oxygen mask theory, which means when you're traveling on an airplane, for example, and in case of emergency, you have to apply the oxygen mask to yourself first before you help anyone else, like children or elderly in your care. Therefore, please take time to relax and take care of yourself. Dr. Arbahe also says, practice social and physical distancing, but not social isolation. One important way to lower the risk of your older family members catching COVID-19 is to limit in-person visits. But this may be tough for older adults who cherish time spent with friends and family members. Arbahe says, social distancing doesn't have to mean isolation or loneliness. We need to keep older adults safe, but also keep in mind that social isolation can have a negative impact on older people's immunity and mental health. She noted that in terms of social contacts, seniors should be encouraged to think about their usual circle of friends, beyond actually their usual circle of friends and family. saying hello to the mail carrier, or checking in on their neighbor and saying hello can give them a sense of connectedness. Arbahi also says, with many houses of worship closing their doors until the pandemic eases, congregants, especially older ones, may feel cut off. Faith communities are often a big part of the older adult's social life. Arbahi says caregivers might help their loved one access online services and outreach for spiritual solace and support. So, technology for staying connected. To help older adults feel involved, purposeful, and less lonely during the pandemic, show them how to video chat with others using smartphones, laptops, or tablets. Use apps on these devices to provide captions for adults with hearing difficulties. Encourage friends and family outside of your household to telephone, write notes, or send cards to lift your loved one's spirits. Keep elders involved. Arbahi recommends giving homebound older adults a project they can work on. Think about going through and organizing old photos and memorabilia together and enjoy the stories and happy memories they inspire. It can be a good time for an elder to demonstrate cooking, a favorite family recipe, or share favorite songs or movies with the other people in the household. I would also like to add, we can read Quran to our elders and have them talk about their experiences growing up in Islamic traditions and what is important to them, what wisdom they would like to pass on to us. We can make these times as a special time to reflect on their life's experiences. Again, I would like to state, if you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel like you want to harm yourself or others, call or for further help by dialing 911. You can also call SAMHSA's Disaster Distress Helpline at 800-985-5990. Also, you may reach me at services at icotv.org for any questions or concerns. And once again, do not react to your elders. Take your time to respond to them. Be mindful, be respectful, and don't raise your voice to them. Model calm behavior. Remember, your physical health is connected to your mental health and emotional health, so be kind to yourself, to your loved ones, and to anyone who crosses your path. Please visit us at www.icotv.org and donate to cover the costs of the Islamic Center of Temecula Valley. Thank you so much. Jazakumallahu khairan.